Hey guys, it's Dr. Heath Lampee here today from BeyonDentistry. Today I want to talk about sedation and sedation options. The way to do more complex work and larger cases is to learn sedation. I also like to call this how to turn difficult patients into dream patients. Patients who typically need a large amount of work are nervous. There's a reason they haven't come to the dentist in 5 to 30 years. Maybe they had a bad experience as a kid, and the thoughts of having drills and scalpels in their mouth while awake is terrifying. Hence, they have stayed away from your office for decades. There are also the gaggers, the people where you can't even touch their lips without them wanting to vomit. I've always wondered, how do they eat their food? Patients who need this kind of work generally don't come in with a check in hand and say, "Oh, I can't wait for you to work on my mouth for 4 hours while I am awake." Hence the need for sedation options. I'll break it down into simple steps. There's anxiolysis, which is 1 or 2 happy pills, preferably halcyons, taken 90 minutes before a procedure. This is good for short appointments or for those with lower dental phobia. Now, moderate sedation is my main form of sedation. There is IV and non-IV. I only do non-IV just because it is easier and quicker for me than IV sedation. Now, it may be different for you and your practice, though. This is for medium-length appointments, about 1 to 3 hours, on patients with a moderate dental phobia. I can do an arch of crowns or an arch of implants in this time frame. Now, general anesthesia is for large, complex cases. Think full mouth extraction and implants and severely dental phobic. Former drug users also apply here because they respond to local anesthetics and moderate sedation meds unpredictably. Patients with complex health histories are great candidates too. Under moderate sedation, these patients will stress you out. I promise you that. So we go general anesthesia for these patients. More and more dental anesthesiologists are focusing on in-office dental care. There's likely 1 or 2 in your area that you need to build a long-term relationship with. The anesthesiologist has been my biggest stress reduction tool for myself and my practice in the last 10 years. Now, there's also hypnotherapy, which I use as an adjunct prior to sedation. I have some of my highest phobic patients see a hypnotherapist prior to their appointment to try and break down the barriers that they have built over their lifetime. This helps reinforce positive thoughts, which I find makes the sedation appointments go over more smoothly, and patients also feel better and seem to heal quicker. Don't underestimate the power of the mind. The biggest secret is you don't have to do it all yourself. Learn when to say no and when to use an anesthesiologist for help. Now, if you want to do these bigger cases, you need to learn these sedation skills. It's not hard to get started. You need to get trained in moderate sedation, and try it. See what works. That's how we learn in life. Oral halcyon and Versed can be amazing, and even the addition of nitrous oxide can make the difficult patient a dream patient. BeyondDentistry teaches the sedation skills to manage these cases and patients. Always check your state board on sedation education requirements and permitting. The big thing is for you, the dentist, to feel good about what you are doing. A relaxed dentist is more effective, and a relaxed dentist goes home happy at the end of each workday. Poorly managed patients are a nightmare to deal with. Anxious patients managed well with sedation are your biggest practice builders and referrers. Thank you for watching. I'm Heath Lampee for BeyondDentistry.